Okay, thank you so much. About I believe our audience, listening audience, by now they have known the different roles that physiotherapists play in the primary care health services. But we would like to know, in a situation whereby we don't have enough resources in those communities, or maybe the facilities are not available, are this group of physiotherapists trained, to make up for those lack in those communities? How skillful are they in order to address and then render their services in the midst of lack?
Okay, so I would like my viewers to know that a physiotherapist, like we say, is a walking or a mobile clinic. So as you see me, a physiotherapist, I'm a clinic. Why am I a clinic? Because the first tools that I use are my hands.
Okay.
Every other thing is an adjunct. The first thing that I do with my patient is to assess them. And when I assess them, my intervention comes first from my hands. So a physiotherapist practicing in the remote community is not disadvantaged in any way, because they have their hands working already. So that's why we'll say, if you don't have function, if you lose function in your hands, you cannot even practice as a physiotherapist. Okay. So that's the first thing I would like our audience to know. The second thing is that I already said that community physiotherapists are people who have acquired additional skills. Why do they have to acquire these skills? It's because of the peculiarity of the community that they need to work in, the environment that they need to render services. Now, in acquiring those skills, it is assumed that it will not always be like in the hospital, in the urban center, where everything is at your beck and call. You have all the equipment and all that. So you are equipped with the skills to know how to innovate, improvise, and make the best of whatever you find in that community. Wow. So as a community physiotherapist, you are skilled in innovation, in improvising. Even in the urban center, we improvise. How much more in the community? So that is to answer your question.
Okay, thank you so much. So are we right to say that this group of physiotherapists working in the community are supposed to be of high qualifications? They are supposed to be skilled in terms of skill-wise. They are supposed to have the best of skills, And again, are we right to say that these people are first contact physiotherapists? In the sense that most of the larger population we have in the rural areas or in our society, most of them find it difficult to access the tertiary health institution. Can we rightly say that this group of physiotherapists are first contact physiotherapists? I would like you to react to that.
Yes, a community physiotherapist is a first contact practitioner. Okay. That is just the simple answer to your question.
Okay.
Why are they first contact?
So why are they first contact?
Because we already know that the resources in the communities are already low. So who is going to refer to you?
Okay.
The only people that may refer to you may be a family member who knows that there's a physiotherapist working in that primary healthcare clinic, okay, or a friend. Okay. So they walk into your clinic and you render your service. So the simple answer is that yes, a community physiotherapist is highly skilled. It is not, in fact, you must have the passion. Apart from the skill, you must have the passion. So it's not an all-comers affair. So they are highly skilled, they are highly trained. Like I said, it's a postgraduate training that earns you the qualification to identify yourself as a community physiotherapist. So it's a postgraduate qualification with a lot of skills and a lot of training and a lot of compassion, because you're working there and it's not going to be like in the city where you have everything. So you must be compassionate and empathic, to work with people in that setting.
Oh, that's wonderful. That's wonderful. And I believe that's clear enough. So community physiotherapists are first contact physiotherapists.
First contact practitioners.
So we expect them to have the best of skill, the best of qualification, because they are the ones to pick out the problems, and if possible, and imagine when you have physiotherapists that are less qualified working in those centers, there will be a lot of issues.
Sorry, my host. I
Okay.
want to tell you that there is no physiotherapist that is not qualified. They only need to have higher qualifications. So anybody that is not qualified cannot even be called a physiotherapist. So the baseline is an undergraduate training. And so you have a physiotherapist. Anything less than that is not a physiotherapist.
Sorry to cut you short. We'd like to know that undergraduate training. Can we know the qualification for that undergraduate training? What's the qualification like? Is it a degree program or,
Okay, undergraduate training is a degree program that is received or delivered in a university.
Okay.
Before now, the benchmark minimum academic standard for physiotherapy training was the Bachelor of Physiotherapy.
Okay.
But as of 2018, the NUC approved that physiotherapists now, the benchmark for their training at the undergraduate level is the Doctor of Physiotherapy training program. So we have even moved from the bachelor to the Doctor of Physiotherapy training.
Oh, that's right. That's right. Oh, and I believe our listening audience have learned one or two things about the qualification of physiotherapists. And I believe that the policymakers, they are listening to us, and they have to push to make sure that physiotherapists working in the communities are, like I say, I'm trying to avoid that are well qualified and they have the best of qualification. Remember, the current trend now is Doctor of what? Physiotherapy. So they have to
standard.
They have to the minimum standard. They have to always push for that so that we can offer the best to our people in the communities. So thank you so much, Ma, for that.